If you're recovering from a stroke or TBI and your hand won't open, your foot turns in, or your muscles stay tight no matter what you do, you're not alone. People mention Botox all the time, but does it really help? Today, Dr. MovingBetter breaks it down and shows how you play the biggest role in recovery.
Thank you, Priya. I'm Dr. MovingBetter. Let's jump into it.
What exactly is spasticity?
Spasticity means the muscle has too much tone. It stays tight and resists movement, especially when you move quickly. After a stroke or TBI, the pathways that normally control movement are disrupted. The muscle gets too much contract signal and not enough relax signal. Think of it like a traffic jam. Your brain tries to calm the muscle down, but the message gets delayed. So the muscle acts like a car with the gas pedal stuck down, firing when you don't want it to. And that makes daily movements much harder.
So, how does Botox help?
Botox works at the neuromuscular junction, the place where nerves talk to muscles. Normally, the nerve releases acetylcholine, which tells the muscle to contract. Botox temporarily blocks the release of acetylcholine so the muscle can relax. This is called chemodenervation. It's precise, it's focused, and it's reversible.
Is that paralysis?
Think of it this way. We're turning down the excessive muscle overactivity so you can move with more comfort and control. It's not cosmetic Botox, it's therapeutic, and the goal is better function.
Does it actually work?
Yes. Multiple randomized controlled trials show that Botox significantly reduces muscle tone, improves passive movement, and helps patients make progress with everyday tasks, dressing, hygiene, walking, and reducing pain from tight muscles. But here's the key, and this is at the heart of RehabLab. Botox is a tool. The real transformation comes from what you do with your body through stretching, strengthening, and neuroplasticity. Botox doesn't create recovery, it assists.
How do you decide which muscles to inject?
We start by looking at common spasticity patterns. In the upper limb, we often see a flexed elbow, a pronated forearm, wrist flexion, fingers that curl into the palm, or the thumb tucking in. In the lower limb, we might see the foot pointing down, the foot turning inward, tight knee flexors, or tight hip adductors. These patterns are very common after stroke or TBI. Then we examine how your limb actually moves, what limits you the most, and which muscles are overactive. From there, we target those specific muscles, often using ultrasound or EMG guidance to make the injections precise.
What does the injection feel like?
Most people describe it as a quick pinch. Even when we treat several muscles, it's straightforward. No general anesthesia is needed, so you can return home right away. Most patients, including those with TBI or stroke, tolerate it extremely well.
When will I notice a difference?
Botox takes time. 3 to 7 days. You begin to feel the muscle relax. 4 to 6 weeks. Peak improvement. Around 3 months. Effects gradually fade. Because the nerve endings slowly regenerate, repeat injections may be needed. The goal isn't to rely on Botox forever. The goal is to use each treatment to help you gain as much function, strength, and efficiency in your movement as possible.
Can you give real examples, especially for someone like me, TBI, with left-sided weakness?
Absolutely. If you're recovering from a TBI with left hemiplegia after a craniotomy, You might have a bent elbow, a flexed wrist, and tightly curled fingers. These patterns make it hard to dress, wash your hand, or use your arm for balance. Targeting muscles like the biceps, wrist flexors, and finger flexors can ease that overactivity. Once the tone decreases, therapy becomes more productive. Or maybe your left foot points downward and inward when you walk. Injecting muscles like the gastrocnemius, soleus, or tibialis posterior can stabilize the foot, making walking smoother, safer, and less tiring. These patterns are classic, and Botox helps reduce the barriers.
Who should consider Botox?
Botox helps when spasticity is getting in the way of your movement, comfort, daily activities, or when tight muscles make caregiving harder. It works best for focal or multifocal spasticity, meaning specific muscle groups, not the whole body. It won't fix a fixed contracture where the tissues have shortened over time. But if the joint can still move, Botox can reduce the overactivity and open up room for real improvement.
Do I still need therapy?
Yes, and this is where the heart of RehabLab lives. Botox opens a window. You, through movement, repetition, and effort, create the recovery. Neuroplasticity is real. Your brain can rewire, your body can adapt, but it only happens when you use the muscles in new, consistent, challenging ways. Botox reduces the overactivity so your therapist can stretch the muscle, strengthen opposing muscles, retrain your gait, and help you practice the exact movements you want to regain. No treatment, not even Botox, can replace the healing power inside you. But Botox can remove the barriers that were holding you back.
Are there side effects?
Most side effects are mild and temporary. Soreness at the injection sites, mild weakness in nearby muscles, or brief flu-like feelings. Serious complications are rare when Botox is dosed and targeted correctly. It's FDA approved for adult upper and lower limb spasticity.
Will Botox make me weaker overall?
If any weakness happens, it's usually mild and limited to the specific muscle we treated.
So what's the next step?
If spasticity is limiting your progress, talk to your physiatrist or neurologist about whether Botox should be part of your rehab plan. Remember, recovery continues far longer than most people think. Neuroplasticity doesn't end. Every gain matters.
To everyone watching, keep going. Progress can be slow, but it does happen.
Thank you for joining us. Keep moving smarter. Keep moving better. I'll see you in the next video.